healthcare union is warning thousands of hospital patients are dying while they wait for care in Ontario. They shared stark numbers here at Queen's Park that paint a grim picture of the healthcare system and are calling on the Ford government to make significant investments.
Staff in Ontario hospitals are cracking under the weight of this tsunami.
CUPE's Ontario Council of Hospital Unions highlighting the wave of problems in a 21-page report dubbed the Hospital Crisis. No capacity, no plan, no end. They found hospital staff vacancies have grown dramatically, increasing 19% over the last year. And currently, 37,000 positions remain unfilled. The vacancy rate of registered practical nurses has more than doubled since the Ford government took office pre-COVID.
A lot of people give up in despair. They just can't do it anymore. They're emotionally, physically broken by the demands of working in the Ontario hospital system, and that's evidenced by the outflow of staff in Ontario hospitals.
A lack of staff leading to fewer surgeries. There's been a 14% drop in the number of monthly surgeries performed since 2019, and surgical wait times are 49% longer than prior to the pandemic, with a record 107,000 patients waiting longer than the maximum clinical guidelines for their surgeries. More than 2,000 people died on waiting lists for surgeries last year, up almost 50% from the year before. Another 9,400 patients died waiting for MRI and CT scans.
It's a heartbreaking tragedy to see deaths that are unnecessary if we would only make better investments in our healthcare system.
In a statement, a spokesperson for the Ministry of Health tells us the government is expanding capacity, getting shovels in the ground for nearly 60 hospital developments over 10 years that will add thousands of beds across the province. They add since 2018, they've built 3,500 hospital beds.
The nominal increase will not even come close to covering off increased demand for services due to population growth. So far, we see no attempt by the provincial government to move on this or to even recognize that they have an urgent problem that needs to be solved.
The union, which represents 40,000 hospital workers across Ontario, is estimating at least 8,100 more hospital beds and 60,000 more staff will be needed to meet patient needs over the next 4 years.
This gap here between what the government has planned and what is needed plays out as personal tragedies for Ontario families every day. We have a government that has no plan, even though the enormity and severity of this crisis has been apparent to everyone in Ontario for some time.
The union has planned a protest here at Queen's Park on September 25th, the day the legislature resumes. For City News, I'm Yazdani.